Well, good afternoon, all. Happy Tuesday, and welcome to another digital health download update for this 7th of July. Let's get into it. So, quick reminder of housekeeping. You can type any questions you have into the chat box, and we'll address them at the end. We will try and leave a bit of time for some Q&A. Everyone is on mute, so we have control on that. And this session, as always, is being recorded through Microsoft Teams. And so if you register for this event, we'll send you a recorded version the next day or this afternoon. But we will make this available also on the PHN website and YouTube channel as well for catch-up. First of all, I, of course, would like to pay respects and acknowledge the traditional custodians of the lands on which we're all meeting for this virtual webinar, and pay our respects to First Nations people in community, pay our respects to elders past, present, and extend recognition to all Aboriginal people who might be joining us today. So what's our agenda for today? So as usual, we'll kick off with a bit of news. I don't have too much for today. There's going to be a revisit of the My Health Record rules changes, but the star of the show today is we've asked Joselyn Barber from Western New South Wales Local Health District to run us through the recent changes to referring patients into engaged specialist clinics within Orange, Bathurst and other outlying district hospitals with the new Healthlink eReferrals. So I'll pass the microphone over to her. So we're very proud to have her today to walk us through. And as I said, any Q&A at the end. So some of you astute followers will be familiar with this slide. I did present this. I'm going to go through what I presented last month because there is a little bit of pick up a bit of confusion, but also do I really need to do this? Well, yeah, would be good too. It is a rule change. And of course, if you are prescribed to My Health Record, you have a policy, you do access it to deliver the best clinical care you can for your patients, then yes, there's some rule changes. So just to recap. Now, I should point out too, a lot of PHN or PHNs around the country have been putting out reminders and notifications about this as well. These in various forms. We've just put out a news page on our website about this today with further links and resources. But the final caveat too is we are, when I say we, I mean all PHNs, are yet to consult and meet up with the Australian Digital Health Agency to try and work through what a new My Health Record security and access policy template might look like in light of these rule changes. So we are hoping to work through that. And so pay attention to this over the next couple of months. Hopefully we can distribute a template that you can readily pick up and utilise in time for the 1st of October deadline at which you need to have your security and policy document updated. But let's just go through some of the requirements here. So it must be reviewed at least annually. And when new or change risks are identified, have that documented. So what they're looking for is, as I keep saying, this is a record-keeping exercise, holding everyone to account, that they're expecting you to look at this, record that you've done so, and keep a dated record. So if you're making annual reviews, it's expected that it's dated, that you've made that review, any changes, and that's stored for a period of 5 years. So the procedures authorising access to My Health Record system and deactivating or suspended user. So again, that's that change, right? If practitioners have come and go, if responsible officer or the OMO has left the organisation in between reviews, then that review will force you to reflect the right people that are authorised. Training, this is a big one. Now, must be provided to employees required, not just before being authorised, okay, but also annually and following any significant changes to the My Health Record system and governing legislation. So in other words, when you see from the agency or from your PHN directly that there's been change, we want you to sit up and take notice, then it's expected that you invest in some annual training. And as we've said repeatedly, you can refer to the Australian Digital Health Agency website. They have a fantastic e-learning module. And so it's all encouraged for especially clinicians, those authorised to view and upload information to a patient's My Health record, to undertake that training specifically. So processes used by the organisation must also address how you'll ensure compliance. All right. So again, that's just the details in the policy. This is how we choose to do it. I'll just before I get to security measures, the bottom one here, no longer required. In particular, this was a default in the current policy template, whereby you had the option to be able to assist patients with registration. However, it's not recommended to include this in the policy. It's only if you provide the service, you have to make sure it's in there. But security measures, the big change here is about security, really. That you must include not only physical and information security measures, but also cybersecurity and technical and organisational measures. So your data protection, encryption, regular backups, all that kind of thing. But more importantly, there's the data breach obligations. So here's where you get your timelines. Okay, so authorising access, that's your 5 years of your record, as I mentioned. Training every year for 5 years. Identification, how your organisation has applied the process. The data breach obligations, so how, again, you'll ensure that it can identify, manage and respond to My Health record data breaches. So again, go to your Essential 8, right? Speak to your IT cybersecurity partners and confirm the process there and make sure it's documented and tested. You should be running through what happens if. Physical security, as I said, this is again 2 years. Each iteration of the policy, again, 5 years. And this is an interesting one for healthcare provider organisations that upload advanced care planning information. So I would suspect we're talking about aged care and general practice. It is now a requirement to keep a record of the recipient's instructions and how their instructions were provided as well. So just keep an eye on those little elements that apply here. Okay, just before I introduce our guest, Joselyn, I wanted to spend a bit of time every now and then in this wonderful role of digital health. Change is a given, a constant, and this is what I call one of those aha moments, and I couldn't wait but to share this with you. And look, there's ongoing discussions that I myself and my colleague Lisa are going to have across the district, both Far West and Western New South Wales LHDs and eHealth New South Wales. But here's a couple of revelations, and if you didn't know this, I don't blame you, because not many people do. But it's one of those curveballs that seem to leave people scratching their head and not realising the answer is actually relatively simple. So let me walk you through it. If you're finding, and the big caveat here too, by the way, is each LHD, each hospital could be using different operations here on whether they're faxing by default discharge summaries or whether they're using the automated system of sending through secure messaging first. But let's just work on the proviso that secure messaging is the default of sending a discharge summary to a general practice. Now, if you're finding you're not receiving discharge summaries via secure messaging channels, so that's your Healthlink and medical objects now. It used to be that Argus was the third that would be included in that automation. There's just Healthlink and medical objects by default. If you're finding nothing's coming through, then my recommendation is to pick up the phone to Healthlink support, and you need to confirm quite a few things. And by the way, this should be a regular task that you undertake whenever there's a change, especially change in practitioners, provider numbers, any details regarding those clinicians under your HPIO. But you need to call up, and there are two immediate tasks. One is jump to point 3, which is make your HPIO an alias to your Healthlink EDI. All right. So again, your RO, OMO who have access to HPOS can get your HPIO from there. It could be recorded in your practice software too. But you need to quote that HPIO to Healthlink support and say, please, can you make it an alias of my Healthlink EDI as an organisation? Okay, that link is critical in the architecture. You also, while you're there, go through all of your practitioners. I'm hearing constant reports of GPs moving around, changing practices, locations, especially in the region, and there's discharge summaries are still going to the previous practice in another town. And that's probably because you're still on record within the Healthlink and medical objects. This extends to, by the way, as well, is that you're still listed under that particular practice in HPAO within the Healthlink and medical objects directory system. And it's a manual process only. There's no way, I can't give you a link to go and self-serve and fill this out yourself. Unfortunately, it's pick up the phone, speak to Healthlink support, and require that this be updated. All right. Just a quick little note there about Healthlink Pro too. So we've noticed that Healthlink Pro and the new free trial to the 31st of August to access Healthlink Direct, which is the new ability to use an online directory, conveniently find the recipient, and then use a smart form or use a messaging correspondence letter within the tool. You have to actually call support or activate the free trial before it will turn on for you. That blue button is visible. So my recommendation, again, while you're on the phone to them, to say, look, we don't see the blue button. We want to trial this out until the 31st of August, until it's pay by month. Can you please turn it on for our practice? And they will literally flick the switch for you. All right. Well, without further ado, I'm going to stop sharing my screen because it now gives me great pleasure to invite, I would say, partner in crime. Isn't that right, Joss?
It is for today.
In the world of Healthlink eReferrals smart forms. So I am very, very, Lisa and I are tickled pink that Orange and Bathurst and some outlying district hospitals are going live very, very shortly with the Healthlink smart form. So if you haven't heard from Lisa and I by now, and this is the first time you're catching up on this, I'll leave it over to you, Joss, to share the wonderful news.
It's very exciting for us too. Thank you for having me to share this news with you and your listeners. We have a lot to look forward to as we extend this out to Orange and Bathurst and some of our district services. So I'll start by telling you a little bit more about the background. There was no standardised approach for referral management for many, many years, and it was an Engage Outpatients program, which was a statewide digital solution from the Ministry of Health and eHealth initiative to standardise and modernise referral management across the state. And a lot of LHDs have taken this on over the course of the last few years. Including Western New South Wales with a Dubbo rollout at the end of 2024. And that was a really good experience for us to test that, put our foot in the waters for the rest of the district. We do have excellent results, and the uptake has been fantastic with a lot of our primary referrers. You know, we're nudging 60% now too, have taken that up, and we were very privileged to have the support of the PHN Health Pathways in promoting that eReferral uptake and continuing that on with our extension through to a few other services. The benefits are manifold, as you can imagine, not just for patient care in general, but for referrers and for outpatient services. So multiple fields like are pre-filled because of the integration with GP software, and that's one of the core incentives for utilising this system, particularly for referring in, plus others such as notification by a secure message for referral receipt and triage outcome. If there's more transparency around the availability of offered services and clinicians. And one of the biggest I think components of this is the integration of the statewide referral criteria into a lot of those eReferrals for those applicable specialties. And the Health Pathways link as well is also in the body of that eReferral. And those two components, having access to that, can really streamline not just understanding of what's available for patient care in the community, but the conditions and information required to streamline that referral into the service for the right care at the right time. For outpatient services, it also helps us because it is transparent, auditable and reportable, and that is invaluable in terms of not just resource management and service planning, but also really streamlining and modernising our referral pathways. Dubbo eReferrals were successful. We've processed quite a lot. We've received, 48,000 over the course of nearly 20 months now. We do receive over 100 referrals a day, and it's easy for us to monitor that. We can look into that system for all our specialties and ensure that there aren't any bottlenecks or address any issues. And again, making sure that what the clinicians are triaging for those specialties that it applies for align with the SRC, as well as those referrals coming into those particular services. And that again is another function that we are really pleased to have embedded in this system, and it really streamlines that patient readiness for care on the point of triage, rather than having to chase further information that's required for those particular referrals. So we're starting to move away from our manual receiving of referrals, particularly from our outdated fax, which is something that we're trying to do by digitising those referral pathways and moving forward with that. We understand that there aren't some alternatives for particular referrers that may not have software that is integrated, but we still have options like EDI as a secure email for some particularly specialists or internal referrals that we manage at that moment through those other means. But eReferral is most distinctly our primary preferred source of accepting referrals into our service, and will be for Bathurst and Orange and some district services from the 22nd of July onwards. So these services, in addition to Dubbo, for Orange, Bathurst and district services, will be accepting eReferrals as we move forward. We're just in the thick of our preparations for that now. There's been a lot of promotion material both internally and getting some training on the tracks, as well as externally, just getting information out to practice managers and primary carers about how to get their practices ready to be able to make sure that the uptake of eReferrals is available to them from the 22nd of July. There's a couple of services at the Cancer Centre in Orange that will be delayed by a month. 1 week to the 29th of July, but we're aiming for the 22nd of July for all the other services in that regard.
Yeah, thanks, Joel. One of the things, before you go to the next slide, just one thing I like about this slide is pay attention to the little asterisk next to the services there that's, again, reference to the statewide referral criteria applies. So it's a good little visual reminder that for those particular services, that's where the eReferral process really comes in handy to support you.
And we've got further specialties rolling out in our 2B tranche towards the end of this year. So another 3 specialties will be added to this as well. So we're creeping up on the capacity of being able to include that SRC in those referrals, which is fantastic.
Right.
End-to-end, this is what I was speaking about, that most practice softwares are integrated, the majority of the ones that are well known, into Healthlink smart forms to get that securely over into the service. We manage the receiving, triaging and management of that referral, and that also for us is integrated into our electronic medical record system. So it is an end-to-end thing for us that not only makes it more transparent and auditable, but also gets into our medical records automatedly too. So that's a massive bonus from the point of when the GP is sitting with the patient. Nothing changes in that regard. There's a few clicks rather than the manual process of what's currently happening in a lot of respects, and the patients are a lot happier in managing to get notification through this system that's automatically telling them that the referral is being received, and the outcome of that referral triaging as well. Accessing Healthlink smart forms, depending on what your practice software is quite easy, and there's a lot of resources available from Healthlink to guide through that process. Best practice is one that we've spoken to quite a few practices, and we're very fortunate to have the support of the PHN to have these discussions as well. There's step-by-step guides on how to get that set up and move forward to making sure that that's accessible and up to date. Like if there's upgrades required for that, to make sure that that's eligible. And Genie is another one that's common, and Communicare also. There is an extra step in that for which IT teams need to engage to make sure that that's available for moving forward for a lot of the AMSs that still utilise the Communicare program. So there are others as well that I haven't included in this, but this is just a demonstration to show that the resources and the support is there to get moving forward, to make sure that your practice is linked up, ready to submit e-referrals through Healthlink smart forms. Once you do that, it brings you through to this page here. You might be familiar with this, which lists all the services available for selection that you could submit that e-referral to. So in this instance, we'd pick Western New South Wales Local Health District, and then you'd come up with the selection. So this is what I mean about transparency, about having all the clinics available who are accepting e-referrals available there for selection for you to refer into. So in this instance, I've selected the liver clinic, for which there are services at Dubbo, Orange and Bathurst to refer that patient into. Certain district services such as geriatric medicine and aged care, palliative care and menopause service that are district-based will also show up as having Western New South Wales LHD as the option for selection, as a district service for pushing that referral through in there, and that's then triaged and managed as per usual. The GP interface is quite easy to manage, and I think we've got some really strong and positive reinforcement and feedback from GPs about this. It pulls over any history medications results over from the practice software into that referral. And here we've got the health pathways link so that you can then be directed straight to further information about the services available in the community, not just public, but also private options should that patient wish to review any alternative health care pathways. And here's a good demonstration of the embedded statewide referral criteria for this particular specialty. This is the liver clinic here, so that comes under gastroenterology. And then those drop-down boxes automatically bring up the fields that are required and the information for that referral to be complete. It also pops through, allows you for selection for transparency of the named clinicians that are available in that clinic, and we do ask for named referrals, so it gives you an up-to-date selection of who is available at that clinic for that referral to come under, plus the referral type in that period there. So fairly easy to navigate those forms. It's not too click heavy. It's fairly reasonable in that regard. That is a concern with change management, but the GPs that are using it currently in Dubbo absolutely love it because of the interface in that regard. And this is a copy of the referral that we received, but it's also stored in the practice software against that patient file. So you've got a copy of that yourself when you keep against that file. This is a demonstration of the link towards the health pathways information. To health pathways credit, there is all the information up in here is up to date for the services, for the availability and any information about requirements. And the more you look in there, the more information you'll find. This is particularly handy for referrers that may not be aware of a lot of the services or alternatives that are available, or the information. And again, this has got that statewide referral criteria listed for those particular specialties for which it's relevant as well. This is another handy feature in the sense that there is automated notification back when you're utilising e-referrals for particular components to the referrer and the patient. And this is not just in line with the Ministry of Health outpatient guideline, but also with that direct communication back to the referrer and the patient that sometimes can take quite a while otherwise, or be quite manual depending on the outcome of that triage rather than the point of receipt and then the outcome of the referral. So this is another massive benefit on making sure that those notifications can come through. And there is capacity for referrers to request, for specialists to request further information from referrers from within that system as well. This is an example of what those notifications look like when they come back into your practice software. It's an excellent end-to-end solution. We're quite happy with using it at our end. The dashboards are easy for us to manage it and look to see where there might be any bottlenecks or issues. We can allocate that internally should that referral be better suited to a different specialty or subclinic. We can also manage that internally, and that will also give notification back to referrers if that is a reassignment to a different specialist or clinic. And that will allow us to, if that patient is currently being seen under service in Dubbo, but perhaps lives closer to Orange, for example, for us to have that discussion with the patient, have that discussion with the alternative provider at Orange, and then transfer that referral internally for management at another service for the same specialty. This is an example of the dashboard that we use. As you can see, super user-friendly. We can hop in, exactly see how many referrals are waiting for us to manage, to triage any that need appointments booked or adding to the wait list. We also have the capacity to put on hold any referrals if there's any further information required that we need to chase up. For example, sometimes there might be outstanding results for bloods, or the specialist may wish to write an MRI form, so we can chase those things to complete that profile for that patient in order for triage to be accurate and then the appropriate care pathway to be implemented. A lot of our referrers have given positive feedback to not just our GPs, but our end users from our specialists as well. We found it's the fact that it's secure, it's easy, it's automated, and the embedding of, again, health pathways and statewide referral criteria in it is transformative in terms of what it can offer, not just referrers and specialists in making that end-to-end pathway more complete, but also streamlining patient care. Plenty of resources and support offered by Healthlink to get referrers going, and they're more than happy to be contacted in various ways by practice managers and GPs, and I'm more than happy to support, as is the PHN, with any information or pointing in the right direction or resources that we have to hand to get everyone linked in and have Healthlink smart forms available for submitting e-referrals. And we've got plenty of resources on our websites as well. And you're always more than welcome to reach out to look at further information about the statewide referral criteria, or contact myself or anyone here, PHN team, for further information too. So very exciting. It's secure, it is direct, and it is easy, and it's something that we're really looking forward to extending across the rest of the district to make that more uniform and accessible.
Absolutely. Thank you, Joss. I was wondering if you could just go back for me. I don't see any questions in the chat just right now, Lisa, but I've got one, because this has come up a couple of times actually with some GPs. It's what I call one of the many curly-whirly, perhaps clinically relevant questions. So if you want to go back to the slide that has the screen grab of the section where you're about to send the reason for the referral, which is linking back to the statewide, this one here.
Yes.
So a couple of GPs have asked me this question: what if I have more than one reason for referral related to the same condition?
If they're comorbidities or there are extensive reasons, you can add that. There's a space to add that where there's further information that might be required, and you can bring over that medical history from that patient to make that referral more complete.
True. True.
And if should that condition be quite urgent, we also encourage that pathway of having a discussion with the on-call specialist or registrar regarding that particular patient care, should that be escalation be required. But yeah, there are fields where you can further elaborate on comorbidities, or if that if there are anomalies in that patient care that need to be addressed within that specialty.
That's right. So I think, as a reminder, everyone, even I get tricked sometimes when I'm educating and training, is when you're looking at static screen grabs like this, it's hard to demonstrate the very fluid smart form functionality. Isn't that right, Joss? Where
That's
once
right.
you select one thing, a magical field appears out of nowhere asking for more information. So I think the encouraging thing here is from the 22nd of July. Well, it's live now for Dubbo and others, but from the 22nd of July, when you're ready for a referral, roll up your sleeves, get in there. The more you use it, the more comfortable I think that will be. So thank you so much, Joss. We have come to time, 2:01. So I'll just finish off by saying very quickly, another reminder, we'll run this session again for next month. I think we're looking about the 11th of August. So keep an eye out for some invites, either via email or, again, best place, go to our website, to the events calendar, and there'll be links to register there as well. We're running a webinar on the active script list for GPs on the 21st of July. So if you're scratching your head saying, what on earth is active script list, then you need to come to that webinar. And again, it will be recorded for all of our content libraries if you can't catch up. But so still register so you can get on the list for distribution. But again, I'd like to thank Joselyn Barber for joining us today, and thank you all for tuning in, and hopefully see you next month. And again, don't be shy. If you want to reach out to us, digitalhealth.team@westernnewsouthwalespHN.org.au. We're more than happy to assist you in the world of digital. Until then, until next month, ciao for now. Thank you very much.